Hello friends, I'm Dr. Poonam Nautiyal. I'm from India and I passed my MRCOG Part 3 in this May exam in my first attempt. I would really like to thank Dr. Sidra and the whole RFA team for making it possible for me. So I passed my Part 2 in November, and after that I thought that I don't need a coaching for Part 3 as I had done Part 1, Part 2 on my own. And I started studying the books. I joined the free groups, and but it was all very confusing. I realized that they are not testing our knowledge, which is already being tested in Part 2. It is more about communication and talking to the patient. And we are not used to this type of exams. So when I joined Dr. Sidra's class, our classes started in Feb, and I was very stressed out and panicked that how would we finish so many cases in like 2 months time. But Dr. Sidra, she took out time and she counseled me that it is possible to do it, and these classes really helped me to understand the communication part basically, and which I think is really important for this exam, to pass this exam. It is like we all know that if it is a previous cesarean, the patient should deliver in the hospital. But how to negotiate with her, how to counsel her, how to talk to her, and how to pacify a angry husband who is sitting outside and some complication has happened with the wife, how to debrief a patient, how to break bad news. All these things are not written in the books, we do it in our OPD clinic, in a private practice, but English is not a first language. So talking in English and using the appropriate sentences, words. So basically Dr. Sidra used to tell in the classes that just cram this up, and she used to give us lines on that. Initially I found it like, how can we do it? But that is really required, what I felt that everything was solved. So we knew that there was no surprise. We did all recalls. It was very difficult to do like 10 cases in a week's time. I joined fast track course also, but because there were classes, we were doing it. So the way Dr. Sidra speaks is like wonderful. It really helps us to know how to talk to the patient and how to counsel her. And believe me, this exam is all about communication. So I'm glad that I joined RFA tutors and I joined Dr. Sidra's fast track course. I was in doubt also for the fast track course, as regular course was not finished. Then how would we will be able to do the fast track course? But fast track course is different set of cases. So if we combine our regular and fast track course both, both together covers almost all the recall questions. And so the exam was not a surprise. We knew how to counsel the patient. It was very difficult in 10 minutes to take the history and to talk to the patient, but I feel that I may missed have points during history taking and other things, but counseling was the thing which I think I passed because of talking and communication and the counseling which I did to my patients. So I would really recommend Dr. Sidra and RFA tutors, and I would really thank Dr. Sidra